Hey everyone, welcome back for another deep dive today. AI in healthcare. It's everywhere you look these days,
It
right?
really is. It feels like every day there's a new breakthrough or a new concern.
Exactly. And that's what we're going to be digging into today. We're taking a look at this really interesting Trend Talk USA episode. They did a great job of, presenting both the potential benefits and the possible risks.
Yes, it's a really well-balanced look at this rapidly evolving field.
So we want to give you the knowledge you need to, form your own opinion about AI in healthcare because it's going to affect all of us, sooner or later.
Absolutely. And one of the things one of the most exciting things about AI in healthcare is its potential to really, to revolutionize how we diagnose and treat diseases.
Yeah, let's talk about that. Trend Talk USA had some amazing examples. Like one that really stood out to me was the use of AI to detect tumors in X-rays.
Oh, right. They mentioned an AI system that was 20% more effective at finding these early stage tumors than human
Yeah,
radiologists.
and that's huge, right? Because, well, everyone knows early detection is critical for successful treatment. Like that could make a real difference in cancer survival rates.
Absolutely.
Right.
Think about the implications. If AI could even just, slightly improve those survival rates, it would be incredible.
And it's not just diagnosis, right? They
Mm.
also talked about how AI is being used to like speed up drug discovery. They
Uh,
said, yeah, I think it was something like AI could potentially shave years off the traditional research timelines.
Cheers. Think about how many lives could be saved if we could get those life-saving treatments to patients, well, years sooner. That's the potential we're talking about here.
They even touched on the Da Vinci surgical system, the robot one, you know.
Oh, yeah. It's fascinating.
It uses, what is it, robotics to assist surgeons with like incredibly precise procedures.
It's minimally invasive surgery, which means, smaller incisions, less blood loss, faster recovery times for patients. It's really impressive what they can do with that technology.
That sounds incredible. It's like
Mhm.
it's like something out of a sci-fi movie. But then, well, Trend Talk USA brought up a good point. It's important to be aware of the potential downsides too, because it's not all, sunshine and roses with AI.
Yeah, exactly. Every new technology has its challenges.
One example that really stuck with me was that skin cancer app,
Mm.
the one that wasn't accurate for people with darker skin tones.
Right, right. And that's a big problem. It shows how important it is to have diverse data sets when you're training these AI algorithms. If the data isn't representative, you end up with biased outcomes. And in healthcare, well, those biases can be really, really harmful.
It's almost like these AIs are inheriting our own biases.
Yeah.
It's something to be really careful about. And then there was that other example, the hospital in Texas using an AI to, I think they called it, to flag high-risk patients.
Oh, yeah, I remember that one. And on the surface, it sounds like a good thing, identifying patients who might need more attention.
Right, but well, their concern was that the algorithm, it might be prioritizing cost savings over the patient's actual need.
Exactly. And you can imagine a situation where people who are, more expensive to treat, they might be denied care, even if they really need it.
That raises some really, really tough questions like who decides, who decides what makes a patient high risk?
Hmm.
And are there like safeguards in place to make sure those decisions are fair? It gets into some tricky ethical territory.
It does. It really underscores the need for transparency and oversight. When it comes to AI and healthcare, we can't just, set it and forget it.
And then, of course, there's the whole data privacy issue. I mean, we're generating so much health data these days from our smartwatches to those mental health apps, and it's not always clear, who has access to that data or how it's being used. It's a little unnerving, honestly.
I know what you mean. Think about all the information your smartwatch is collecting, your heart rate, sleep
Yeah.
patterns, even your location. And then you have those mental health apps that, the tracking your moods, your anxieties, your thought patterns. It's a lot of really, really personal information.
Right. It makes you wonder, like, who owns this data,
Mm.
and how is it really being used? It feels like a gray area.
Yeah, it definitely raises some big questions about data ownership and privacy in this new world of AI-driven healthcare.
So it seems like we've got this incredible potential for AI to improve healthcare in so many ways, but at the same time we have to be very aware of the potential risks. Like it's a real balancing act.
I think that's a great way to put it. It's a balancing act, and we need to be having these conversations now. Before it's too late. We need to shape the future of AI in healthcare in a way that benefits everyone.
Well said. Now, luckily, TrendTalk USA didn't just leave us with all the doom and gloom. They actually presented like a more optimistic vision for the future, which they called the human AI partnership. So it's not about AI taking over, right? It's about AI working with us, empowering us. And they had some really cool examples in Trend Talk USA of what that could look like.
Oh yeah, definitely. Like the one that really got me thinking was the telemedicine one. Using AI to help doctors provide care remotely.
Oh yeah, yeah, using AI for telemedicine.
Yeah.
That was fascinating.
Like imagine, right? You're in a rural area. Maybe you're hours away from the nearest specialist. But with telemedicine, you could have a video consultation, and the AI could be there, assisting the doctor, analyzing your symptoms, comparing them to huge databases of medical information, suggesting possible diagnoses, treatment options, things like that.
It could really, really help people in those underserved areas where they might not have easy access to specialists. It's like bringing the specialist to them
Yeah,
virtually.
exactly. And it's not even just geography, right? It could also help with shortages of healthcare professionals. Imagine an AI that can triage patients, maybe handle some of the more routine inquiries, even assist with some basic diagnoses. That would free up the human doctors and nurses to focus on the really complex cases, the ones that really need their expertise.
It would make healthcare so much more efficient, wouldn't it? And effective.
Absolutely. And then they also talked about the wearables, the smartwatches that can detect heart problems before they even become emergencies.
Right. Like your smartwatch could be monitoring your heart rhythm all the
Mhm.
time. And if it notices something off, it could alert your doctor, maybe even call 911 if you're having a serious cardiac event.
It's like having a personal guardian angel right there on your wrist. It could literally save lives.
It's amazing how AI can be used in these preventative ways too,
Right.
not just treating problems after they happen, but actually helping to prevent them in the first place.
Yeah.
And then, I love their discussion of AI in mental health. Like, have you heard of Wobot?
Yeah. Yeah, it's an app that uses AI to provide like real-time support and coping strategies.
Yeah, it's like having a therapist in your pocket, you know, available 24/7. You can chat with it, you can track your mood, you can get personalized advice, learn coping mechanisms, all sorts of things.
It's really helpful for people who maybe can't see a therapist as often as they'd like, or who need that extra support between sessions. It's
Yeah.
it's like a bridge, between therapy
It
appointments.
makes mental health care so much more accessible
Yeah.
and convenient. It's really exciting to see how AI can be used in these positive ways
Mhm.
to really help people.
I agree. And it really highlights the potential for AI to be a force for good in healthcare, especially when it's designed with human needs in mind.
Right. It's not about replacing humans. It's about empowering them. But even with all these amazing benefits, we have to remember, right? AI is a tool. It's not a magic bullet.
Exactly. It can do amazing things, analyze data, make predictions, help us make decisions, but it can't replace the human touch, that empathy, that understanding that's so important in healthcare.
AI can't give you a hug.
You're right.
It can't sit with you and really
Yeah.
listen to you the way a human can.
Exactly. And I think that's something Trend Talk USA really, really emphasized, that we need to find the right balance between the human and the artificial.
It's not about choosing one or the other, right? It's about figuring out how they can work together, how we can integrate them in a way that makes healthcare better for everyone.
Yeah. To create a system that's both technologically advanced and human-centered.
So where does that leave us? So we've talked about all this incredible potential, all these amazing ways AI could change healthcare. Faster diagnoses, life-saving treatments, remote care, personalized mental health support, all these things.
We've also talked about some of the potential risks, right? The need to address bias, to protect data privacy, to make sure that human touch doesn't get lost in all of this.
It's a complex landscape, that's for sure. But one thing that Trend Talk USA really drove home was the importance of staying informed, of staying engaged in this conversation.
Yes. They said the future of healthcare, it's not predetermined, right? It's something we're all creating together through the choices we make, the conversations we have.
And as you continue learning about this, about AI in healthcare, here's something to think about as we go further into this world of AI in healthcare. How can we make sure that it's actually benefiting everybody,
Yeah.
not just a select few?
It's the big question, right? And it's something we all need to be thinking about, talking about.
It's easy to get caught up in the excitement, the gee whiz factor of it all, but we can't forget about the human side of healthcare. That's what it's all about ultimately.
Absolutely. We have to make sure that AI is being used to help doctors and nurses, not to replace them.
Right. It's about finding that balance,
Mhm. Yeah.
where AI can do what it does best,
Yeah.
analyzing data, making predictions, and that frees up the humans to do what they do best.
Exactly, building relationships with patients, providing emotional support, making those really tough judgment calls that require empathy and intuition.
And those are things that AI just can't do.
Right. Anyway, maybe someday. But for now, we need to make sure that technology is serving humanity, not the other way around.
So what can we do? I mean, what can we as individuals do to make sure that AI is being used responsibly in healthcare?
Well, I think the first thing is just stay informed. Read articles, listen to podcasts, go to talks. The more you understand about AI, the more you'll be able to advocate for its ethical use.
So become an informed citizen of the AI age.
Exactly. And
Okay.
and don't be afraid to ask questions. If you're interacting with some kind of AI healthcare tool, ask how it works, what data it's collecting, how that data is being used.
Yeah, be an empowered patient, not
Yeah.
not just a passive one.
Yeah. And remember, you have a voice. Talk to your doctor, talk to your elected officials, share your thoughts and concerns about AI in healthcare, because the future of medicine is being shaped right now.
It's happening whether we like it or not, right?
Yeah.
So we better make sure we're part of that conversation.
Exactly. And that future, it could be amazing. I mean, we really are on the cusp of a new era in healthcare where AI could help us, live longer, healthier, happier lives.
But it's up to us to make sure that happens. It's a responsibility we all share.
Well said. I think TrendTalk USA did a really good job of laying out both the amazing possibilities and the potential pitfalls of AI in healthcare. It's a complex topic, and it's changing all the time.
And we hope we've given you some food for thought today, some things to consider as you navigate this new world.
As always, we encourage you to keep exploring, keep asking questions, keep learning, because the more we understand about AI, the better equipped we'll be to shape its future.
So that wraps up our deep dive into AI in healthcare. Thanks for joining us.
Until next time, stay curious, stay engaged.
And remember, the future is what we make it.